I am a third-year hematology fellow. I'm in my research year. I am at the University of Washington in Seattle. And my research interest is in sickle cell disease. For me, my initial interest was actually in sickle cell disease and trying to figure out how to work with patients with sickle cell disease. And eventually just was a natural progression towards medicine. I initially considered research because I think I always thought, well, I have to find a cure. And I think my personal statement for college was about how I wanted to find a cure for sickle cell disease. And then I did about a year of bench research and realized it wasn't for me, but was very interested in clinical research. And so it just naturally progressed towards an interest in medicine. So I am especially interested in neurocognitive outcomes in patients with sickle cell disease. We know that neurovascular complications are common, so strokes or what we call silent infarcts, and these lead to cognitive impairment. However, we still see cognitive impairment outside of strokes. And so my research really is trying to understand what the pathophysiology is for that and trying to truly understand why patients develop cognitive impairment even outside of strokes. I have to just say thanks to my co-fellow. Her name is Debbie Jang. And her and I think we had a conversation a week prior just talking about research and funding opportunities. And so my initial, I think she sent me an email and said, hey, I was looking on the website and I found this. I don't think I'm eligible, but I think this would be perfect for you. And so she ended up forwarding me the information. And I went on the website and I thought, this is wonderful. Initially, I thought Hemophilia Foundation is probably like bleeding disorders. And then I saw that it was expanded to blood disorders in general, which I just have to say thank you for that. And including sickle cell as part of that. Because it's really an underfunded, under-researched disease. And so she sent me the information and I was able to find out a little bit more and then sent it to my division chair and our heme admin to make sure that I would be able to apply for it. As I mentioned before, I'm a third-year hematology fellow, and I think the first year really was trying to find funding sources for my research. And so it was really delayed because I couldn't start the project. And so this one is just a major relief and that burden of trying to find funding and actually being able to start the project and continue the project. It really is important is that it sets a foundation for me. It's something that I can now get my research and hopefully build on this for future career development grants, and really a foundation for what I'm hoping would be a prolific career in hematology. I think I probably could say I have both for better or worse. I think for worse, in my training, I've definitely experienced some macro aggression that comes with that really deals with my skin color. And so I've had those instances, and I've had in my med school, I had my core group of friends that I was able to talk to about such experiences. But as I sort of progressed in my career, there were less of people that looked like me in fellowship and also faculty. And that's why I'm really also a proponent of really trying to increase recruitment and retention of more minorities in the field of medicine. So starting from medical school all the way to faculty, I think it's especially important, especially for mentorship and those who may feel isolated or not having that person or the outlet to talk to whenever we experiences such prejudices or such racial sort of or discrimination or whatever it may be. I think for better, me being a sickle cell or wanting to be a sickle cell provider, I think it's incredibly important. And when patients see someone who looks like them, I've been told many times from patients who are just very excited to have a Black doctor because one, they actually haven't seen one and are just even very proud of me. I've heard many people tell me how proud they are of me, of being a doctor. Some people feel comfortable having a Black doctor. So I think for better, it's being able to be that physician that patients, especially my patients, sickle cell patients, it affects predominantly Black people. And so having someone who look like them, I think it's just as important as well. The prejudice of being a drug seeker or having drug seeking behavior. I think that's one thing. I think another thing is it's and this one is sort of one of those double whammy where sometimes I think there is this prejudice or this belief that Black people are strong, and so people underestimate the amount of pain someone might be in. I remember we had a workshop. This was in my health disparities course that we were taking, and we were split into two groups and given a case each, talking about someone who came in with pain. So it gave you a little bit of a history with the patient, and then you got to discuss it with the group and eventually come up with a plan of would you give narcotics or not. And so one group argued for no narcotics, and the other group argued for narcotics, saying, he had gotten some treatment. I think it's time for that they could trial a short course of narcotics. And at the end of the course, what we found out really was that it was the exact same case, but two different races. One was a Black person, one was a white person. How much of that implicit biases we have that can affect patient care. So the person who was a Black patient was the one where people felt that they could still prescribe something else rather than narcotics, even though I think at the time we had maxed out on all the sort of non-narcotic pain medication that could have been used. And then for the other patient, people felt very comfortable easily prescribing pain medication. So it was just I remember that course, we had a few cases like that where it really shows sort of that implicit biases that we all have. And one has to do with a person's skin color. And so a lot of sickle cell patients face those prejudices every single time. It's really tackling these issues earlier. I think now our institution is recognizing that they've incorporated, I think it was originally a USC workshop, where it's a workshop about really microaggression in the workplace, implicit biases, and they do sort of, I think, a day or a couple of days of them. And that's great, but I think now you're trying to address behavior of someone who's, in their 50s, 60s, 70s, and trying to change behavior at that age is it's a lot harder than really showing these kind of biases or earlier on where people can recognize it and try to correct them. In our everyday practice, we are going to likely come across some sort of situation where that's going to take effect, where your biases, it could be just even my bias coming into play that I'm not aware of. So one, showing students that it does happen with the different cases that we see. So even if it's, unfortunately my bias, trying to make it a teaching moment for either the residents or the med students that I work with, I think that's something that I would definitely continue to incorporate in my teaching. And I think, like I said, I just really think it's important that we have those kind of like the course that I had for my health disparity course. If we can have something like that, where we could just incorporate it in part of the training. And so It's something that I'm certainly interested in because I think that course really opened my eyes to a lot of things that I wasn't even aware of. And so
Mhm.
I think just being aware can really make a difference. It's interesting because I grew up in Nigeria, so we don't have Black History Month in Nigeria. It wasn't until I moved here to the U.S. that I learned about Black History Month, and what I initially in high school, I think for me, I was just like, oh well, I get a day. I think we get a holiday around that time, and you learn about these historical figures. But it wasn't until I started growing up that I really came to appreciate it a little bit more. It's been really just really interesting finding out more about African American history than I usually do from regular history books or even when I grew up in just growing up in Nigeria because we don't learn as much about African American history. This type of history should be incorporated in just regular history that's been taught and not just having a separate um, month. I think it's great that we have a month to highlight it, but I think also finding a way to incorporate it as part of just history in general. I'm just incredibly happy to be a recipient of the Jeanne Marie Lusher Award, named after someone who also, has contributed so much to medicine, and so incredibly honored and very thankful to be a recipient. And I'm thankful that we get also more funding for sickle cell disease. That's really um, very underfunded and under researched. So um, I just want to say thank you.